Thank you for joining us this afternoon. This is the PCPCH, the Patient-Centered Primary Care Home Program Learning Collaborative for Standard 2 around staff vitality. My name's Bernadette Lauer. I'm one of the improvement specialists with the program. I'm going to facilitate today's event. And I think while everyone's getting settled and we're still welcoming people in today, I think we'll go to the next slide and we'll kind of just talk about some logistics and some Zoom etiquette for the day. So as many of you can see, this learning collaborative is being recorded. If you have any technical challenges with Zoom, feel free to private chat Amy Harris. She'll help you out today. We'd love to facilitate a shared learning environment and connection. So if you're comfortable, please turn your camera on. We'd love to see your faces. Also, if your name is not visible on the little bottom toolbar, if you could go ahead and update that for us and include your organization. There's 3 little dots, so you should be able to click to update that. And then lastly, if you have any sort of comments or questions as we're going along, feel free to drop those into the chat. We're definitely keeping an eye on the chat, and we'll have a few different question and answer pauses throughout our session today to get to your questions. So let's get going and get on to our next slide, which is our agenda for the day. So we're going to start out, we're going to do a little icebreaker, get everyone engaged on our lunch hour. We'll then talk about Oregon's PCPCH model, do some review of that. We'll review some technical assistance resources that we have for you all. We'll talk about PCPCH Standard 2F, and we'll also review a toolkit that the program developed and put together for you all. And so then after that, we're going to jump into practice sharing. So we're going to get into practice sharing pretty quick today. We have both Valley Family Healthcare with us today, as well as Adapt Integrated Healthcare. After we hear from both of those practices, we're going to have a little bit of a Q&A panel discussion around some equity considerations and staff vitality. We have Virginia Garcia Memorial Health Center with us, as well as North by Northeast Community Health Center, and we're going to have a great conversation with them around that. And then we'll end the day again with another couple links around some resources for you all. Let's go to the next slide, and we're going to jump right into our icebreaker. So before we begin, feel free when we do this, just type your answer into the chat, go ahead and hit enter, and we'll kind of just see everyone's answer as we go. So Amber, if you want to get that question up. Today, we want to know in 2 to 3 words, so very brief, tell us the most enjoyable work-sponsored event you have attended. So something that maybe you've done at work or in your practice that you'd love to do again, kind of what start Friday, our Friday Learning Collaborative off with some joy. So feel free, a couple words, type your answer, put it in the chat for us. And as they come through, we'll talk. It looks like some holiday galas. I think holiday events are probably pretty popular with everybody. Some summer parties, staff retreats, burnout prevention, Christmas parties, yard games, summer picnic, staff volunteer opportunity with like United Way, more holiday parties, a 70s disco party. That sounds like a lot of fun. A fall leadership forum. That's a good one. Some all staff meetings. Lots of information at those all staff meetings. Let's see, a co-baby shower. That's very fun. I love doing those. Looks like there's an escape room on here as well. More yard games, lots of holiday parties. Let's see, doing Pride March in Beaverton this Sunday. That is exciting for Pride Month for everybody. We also at the end of a community organizing session, we had a dinner to reflect on the year's event. Oh, that's wonderful. I love all of these events, everyone gathering together and hopefully having some joy together. Also, True Colors, a personality quiz with staff. That's very fun, kind of really get to know each other that way. All right, looks like we've all slowed down putting some things in the chat, but those were all some wonderful ideas. So I hope that kind of sparks some thought and some maybe questions or some things that we're going to talk about today in our session. So let's go to the next slide, and let's talk about the Patient-Centered Primary Care Home Program. So the program was established in 2009 by the Oregon State Legislature as part of the state's broader transformation effort to achieve better health, better care, and lower costs within the health system. The intent was to improve Oregon's primary care system by developing a set of standards for primary care practices. After the legislation was passed, a volunteer advisory committee was convened to develop the PCPCH standards. The committee has reconvened several times over the years to refine the standards. There are more than 600 primary care clinics that are recognized as PCPCHs in Oregon, which is about 2/3 of all primary care clinics in the state. There are recognized PCPCHs in 35 out of the 36 counties in Oregon, and approximately 3/4 of all Oregonians get their care at a PCPCH. Lots of PCPCHs out there. They also range in size, from clinics with 1 provider to clinics with over 200 providers and clinical staff. So our PCPHs are pretty diverse just in themselves. Let's get to the next slide. So participation in the PCPCH program is voluntary and recognition is attestation-based. So the program comes out and conducts site visits to a select number of PCPCHs each year to verify that clinics are meeting the measures they attested to in their applications and to provide technical assistance. The PCPCH recognition criteria is defined by 6 core attributes, each with specific standards under each attribute, and measures that indicate the extent to which a clinic is meeting that standard. There's 11 must-pass measures that all clinics must meet, and then there are more than 50 optional measures that are worth 5, 10, or 15 points. There are also 5 tiers of recognition based on which measures a clinic is meeting. Go to the next slide. Our next slide here, some technical assistance resources for you. So I'm going to go through them, and as I go through them, we're going to drop links to all of these in the chat so you guys can click and follow along if you'd like. The first one is that PCPCH 2020 Recognition Criteria Technical Specifications and Reporting Guide, also known as our TA guide. Feel free, the link is always the most updated version, so that would be where I would go. And again, we'll drop that link in the chat. The second link that we're going to talk about that's being dropped in the chat is the link to sign up for our PCPCH listserv. With that, you could receive the program's monthly updates via email. The monthly email includes program changes, upcoming TA opportunities, and other really helpful information around the primary care health system transformation in Oregon. It's also how we promote a lot of these learning collaboratives that we've been doing. So lots of good information in there. Feel free to sign up if you haven't already. And then the last link is the link to our PCPCH program website. So on the website, you can find things like extra guidance, 1-page documents for select PCPCH standards and measures. There's also recorded webinars for select standards and measures, as well as a webinar for the overview of the PCPCH site visit process. We also post the links to the recordings of these learning collaboratives on the website. So it's really the best place to go if you want a good kind of library of all PCPCH related TA. And then lastly, there's also resources to assist your practice with health equity initiatives. Let's go ahead and hit the next slide. And we're going to go ahead and get into PCPCH Standard 2F. So this standard is all about staff vitality. The standard has 2 measures that increase in complexity and point value. It's not a must-pass measure, and it's a progressive measure, meaning that practices can attest to either 2F1 or 2F2, but not to both. So I'm going to read the measures as they are on the screen. 2F1 is PCPCH uses a structured process to identify opportunities to improve the vitality of its staff. That measure is worth 5 points. And then there's measure 2F2, which is PCPCH develops, implements, and evaluates a strategy to improve the vitality of its staff. That measure is worth 10 points. Go to the next slide. And with kind of that in mind, we're going to dive a little bit deeper into measure 2F1. So the PCPCH measure 2F1 is all about identifying opportunities to improve staff vitality. So practice is meeting measure 2F1 if it can define its ongoing strategy for addressing staff vitality, which includes methods used to gather feedback from all employees to be completed at least once per year. How results are shared with the entire staff. And some examples are email, internal newsletter, all staff meetings. And then also actions taken by the practice that directly impact staff vitality that are based on the staff feedback. And that last part, based on staff feedback, is important. Let's go to the next slide, and we'll move on to PCPCH measure 2F2, which focuses on developing, implementing, and evaluating a strategy to improve staff vitality. So a practice's meeting measure 2F2 if it is able to define its ongoing strategy for addressing staff vitality, which includes those methods that are used to gather feedback from all employees completed once a year, how those results are shared with the entire staff, actions taken by the practice that directly impact staff vitality based on that employee feedback. And then this last bullet point is really the difference between 2F1 and 2F2, which is how these actions or activities are monitored and evaluated for progress or success. Let's go to the next slide. So today's presentation is the second part of the two-part learning collaborative on Standard 2F. So our first session, which was on June 9th, is recorded, and you can find a link to that recording on our website. We'll drop a link in the chat too in case you want to pull it up for later. And then also on our website, and we'll post the link in the chat as well, is our Staff Vitality Toolkit, which we, as a program, created to help facilitate the implementation of Standard 2F for you all. So really encourage everyone to check out that webinar if you weren't able to attend. And definitely the toolkit, there's lots of resources in there. A lot of our practices helped us and gave us some great examples that we were able to include in there, as well as some tools that we developed for you all around. There's a PDSA template we've developed, as well as a discussion sort of template that we've developed for you all. So feel free, take a look. Those links are in the chat for you guys. So let's go to the next slide. I did a lot of talking in those first 12 minutes, and I just want to pause and see if there's any questions from anyone. I didn't see anything in the chat, but again, I just wanted to pause and make sure there's no questions popping up for anyone before we get into our practice sharing. Okay, I don't see anything, and so in the interest of time, I am going to move us forward because we've got really great practices with us today with lots of information to share. So let's hit the next slide. And the first practice we're going to hear from today is Valley Family Healthcare. So we have Lindsay Farrell with us. And Lindsay, I'm going to pass it over to you.
Awesome, thank you. Yes, my name is Lindsay Farrell. I'm the Quality Improvement and Quality Assurance Specialist for Valley Family Healthcare. And I also have Jennifer Hood. I believe, Jen, do you want to introduce yourself?
Yeah, hi. Sorry, guys, I'm having issues with my video. But yes, I'm Jennifer Hood. I'm the practice manager of the Emmett and the New Plymouth Clinics, Valley Family.
Awesome. So next slide. So a little bit about Valley Family. Our very first clinic was established in 1982 in Payette, Idaho. Currently, we now have 9 medical clinics. Our most recent clinic just opened in May of this year, and 4 dental clinics. We also have integrated behavioral health in all of our medical clinics, and we have a mobile access clinic as well. We're located in 2 states, both Oregon and Idaho, and 3 counties. We have quite a distance between each of our clinics. I think the longest span is about 60 miles, and all of our clinics are very, very rural areas. We're a nonprofit and a federally qualified healthcare center. Our main focus is providing quality healthcare to everyone, regardless of their ability to pay. Our board of directors is all volunteers, with over 70% of them being current patients of Valley Family. And we currently have 77 providers, and I think that number actually just changed today. I think we're 80 now. And that includes all of our providers, medical, dental, and behavioral health. And in 2022, we served over 21,000 patients. The next slide. So one of the main areas of focus for our 2F2 is our annual survey. So every year we have an annual survey that goes out to every employee in the company. We do use a third-party survey company, and then they send the information to admin, and it's distributed from there. The surveys are completely anonymous, and we use those numbers and compare our results year to year. And next slide. So this is just a quick view. I know it's not really easy to read, but this is what we received from the company. So across the top is our 2021 and 2022 results as an organization, and then it breaks it down by every clinic, and then also other departments such as billing, medical records, IT, all of those. And then on the left-hand side is each of the questions. So we use this heat map to really easily identify areas that we're doing really strong, and then also identify areas that are weak and we need to focus on for improvement. So next slide. So of course, starting the survey, I think it was 4 or 5 years ago, we've had some struggles that we've worked through, and we really wanted to talk about those too, because that's part of our improvement process as well. And so one of the struggles that we had, we originally was using Microsoft Forms and doing the survey through our administration department, but there was, people didn't really want to complete the survey because they were worried that it wasn't actually anonymous and that their answers would be able to be shown as who they were. So that's when we switched over to using a third-party company. And we also struggled with low engagement, but we are and have been working on that. And we started using incentives to help people want to complete the survey. So like last year, if your department had over, I believe it was 90% of the department had completed the survey, then we all got lunch. Each department got lunch bought for us. And then also some of the areas that we typically score lowest in is communication and recognition. So the next few slides, we're going to talk about some of the things that we've been doing to improve in those areas. So next slide. So what have we changed or implemented from these results? So first section, employee satisfaction. Last year, they identified with the rising costs of insurance and then also inflation that they needed to do something to help us, because that did come out of the survey, was that we were not competitively compensating the employees. So we did get a larger raise last year, and I mean it is based on performance, but the percentages were higher than we've ever been offered before. We also started doing clinical staff meetings. Since we have dental clinics, originally we were allotted a certain amount of money as long as you went to our dental clinics, but coming out of the survey, there was concerns about that. And so we switched from having just our company to being able to use dental insurance across any dental clinic. So also now we have an employee newsletter that goes out every other week, and it gives information about the clinic. It also highlights employees. One of the things that we do is go around and ask employees, we highlight like 2 or 3 employees and ask them more about like who they are on a personal level, like some of the things that they like to do, and give employees a chance to meet each other. We have almost 300 employees, and so it gives a chance for everybody to get to know each other. Every staff meeting, a leadership person is assigned. So whether it's one of the chiefs or directors is assigned to those staff meetings, so they attend those for the clinics. One of the biggest, huge areas that we've improved on coming out of the surveys is we've recently transitioned to Ocean Epic. So last year we transitioned over, and that has made a huge difference in our clinics. We also are working on revamping our new hire orientation. After COVID, our orientation kind of dive bombed, and we got some pretty negative feedback from that out of the survey, and so we've redone that. We also recently, just a few months ago, was able to implement admin time and for providers, so they didn't have that admin time before, where they could use that time to put in notes. And then also another thing is our 403B, which is our retirement program. You're vested immediately. So that program starts after, I think it's either 60 or 90 days, and then you're immediately vested within your first contribution. And last on the employee satisfaction is there's really been a focus on staff engagement and engaging staff in staff meetings and engaging them in all staff meetings quarterly, which we're having in person now, and those sort of things. So next slide. So another area that we focused on and continue to focus on is safety and security, and that is physical safety, but also emotional safety. So we have what we call as a We Care program, and we train staff every other week. We bring staff in, and it really promotes a culture of safety for staff and patients, but it also, it talks about like the importance of turning in incident reports, as well as burnout and trauma-informed care, and then also self-care and what that means and how that might look like for each different individual. And then also we have positive messages at the beginning of each meeting. So whether it's a staff meeting or any other kind of meeting, both in the clinics and then in administration, it always starts with a positive message that that a different person is assigned to. Recently, we've started adding lights to parking lots because during the winter, of course, it gets dark early, and that came that and the cameras both came out of some of the conversation around some of the answers from the survey. We're also just getting ready to pilot Alert Us, and I don't know if I spelled that right. I couldn't get a confirmation from anybody, but it'll be an alert system where if a nurse is in a room and a patient is out of control or front desk is being threatened, that they'll be able to use a program where they can alert people that there's a problem. And then also for our EAP program, they increased the amount of visits that we're allowed. So we have 4 visits now per incident for our EAP program. So next slide. So some of the things that we've done to focus on recognition, we have an annual Spirit of Valley Family Award. So one person across the organization gets nominated for that award. And then also quarterly, we have Values and Action Awards. So each of our values that we have as an organization, there's one person per quarter that's nominated. And so across the company, we get to nominate whoever we want, and then they take those nominations and choose the person that wins those each quarter. Then there's on Paylocity, which is our payroll system. We're able to go in there and give impressions to other staff members on things that we really like about them or things that maybe they've done well. And we also, some of the clinics also do like incentives for whoever gets the most impressions in a month. For every single year, they do a big summer party for all of the staff and their family members, and that changes every year. So a couple of years ago, we did Wahoo's. Last year, they went to the Pitt County Fairgrounds and had like a dunk tank and food and vendors and like all sorts of stuff that's all paid for by Valley Family, and everybody's invited to. And then we already kind of talked about the employee newsletter, but that got brought up with recognition as well because of we interview different employees every single month. And then they have a long-term employee appreciation dinner. So if you've been here 5 years or more, they do a big, huge dinner at one of the restaurants locally, and Valley Family acknowledges those employees and takes them out to dinner. So next slide. All right, Jen, you are up.
All right. Thanks, Lindsay. That was awesome. That was a really good presentation, lots of information. So I am here to kind of bring it down to the clinic level and how it trickles from leadership. And so we have a practice manager huddle every 2 weeks. Our nurse leads are included in that every other week. And that's kind of how information gets from leadership down to the practice managers. And that's how we get that information out to our clinics. So we have a huddle every morning where we go through any important information, or new workflows with Epic or things like that. We also go over our schedules. And so if there's anything special, we communicate that. When Lindsay showed you the graph earlier of the survey results, those results are given to the practice managers. And typically what we do is we choose the bottom 3. And those are our focuses over the next, couple of months, over the next 6 months to a year. And we really work on, kind of delving into disseminating the results and talking to the staff and getting their opinions and their ideas and feedback onto maybe, why that score was so low, where do we improve, those kinds of things. And so, and then that's addressed all throughout the year, but also we do other things in those staff engagements, as far as that's where we, we have a monthly operations review every single month with all of the leaders of the company. And we, of course, go through finances and we go through survey results and things like that. But one of the things that we really talk about is staff engagement amongst ourselves as leaders, because it's really cool to collaborate with some of the other managers on what they're doing. Some people will do a riddle every day, in huddle. I do these fun random quizzes, that kind of break the ice and get people involved. And then they have, different types of competitions within each clinic, and sometimes throughout the whole company. one of the things that we really focus on is the patient portal. We'd really like to get people signed up for that. And so what we do is we have a company goal, and when you meet that, you get a pizza party, or like Lindsay said earlier, we really incentivize. And then and so each clinic, each practice manager has their own way of getting that through to their employees, and it's kind of fun to collaborate and get ideas from each other. And so we do that once a month. And then, like Lindsay mentioned, we have the insider. And the cool thing about the insider is it doesn't just come from leadership. Anybody can put a story or a little publication in the newsletter. So if your clinic has done something great, it's really fun to let the entire company know, because you can, send that and it gets published in the insider. And then, like Lindsay said, we focus on 2 to 3 employees every 2 weeks on who they are and what they do, and special things that, their personal life and the kind of fun that they have outside of work. And then we actually, I can't remember, Lindsay, if you had mentioned this, but we have 2 all staff meetings a year where we go in person. One, we just had one in May, which was the entire company. And let me tell you, that was really fun, because you get to see people you haven't seen in a while, because you don't always get to float to the other clinics. But every clinic does something different. So for instance, I know my New Plymouth clinic, we actually decorate for every single holiday. It's a smaller clinic, so it's easier. And we have these 2 pine trees. They're not Christmas trees, but they're kind of pine trees, and we decorate them for every holiday. So January is New Year's, February is Valentine's. Right now there's beach balls and summer decorations all over. We have employee boards where we have pictures of each other, and like for instance our Halloween party. We had pictures of every individual as well as the group, and then the company had a contest, a Halloween contest. And so I see on the screen there that we are kind of going through some of the questions that are asked on that survey and some of the results that have come through, and how are we going to improve those? Sorry, I'm kind of going all over the place.
Jen,
go ahead.
I'm going to jump in for just a second.
Yep.
We're just running short on time. So these ones that are on the screen right now, these are the 2 areas in New Plymouth and Emmett that they had one of the lower scores that they were working on and reported on that monthly operation report. And then that's the difference from 2021 to 2022 that we saw big jumps from 3.7 to 4.5, and then from 3.6 to 4.1.
Yeah. And so go ahead, the next slide. Yeah, so this is
a lot of that stuff you were talking about.
Yeah, this is a lot of it. Sorry, I wasn't going off the PowerPoint. But yeah, this is just a lot of our focus is trying to get out there in the community. And we do, New Plymouth just went to the Senior Citizen Barbecue. We were a sponsor there, so it was really fun to be there. Like Lindsay mentioned at our staff meetings, one of the goals for the company is that leadership really has a presence in the clinic, and so they come to our staff meetings, they pop in, and they are really good at getting to know everyone, from the front office to the providers, and making their faces known. Some of the clinics do kudos boxes where each staff member puts a kudos, and once a week we draw and somebody gets a scratch off ticket, or they get, a coffee card or something like that. Birthday celebrations, we do potlucks every month and celebrate everybody's birthdays. There's the decoration for the season holidays. Friendly competitions within the clinic or even amongst the clinics is kind of fun too. Daily huddle, joke of the day, and other pick-me-ups. And then right now in New Plymouth and Emmett, we're doing a baby picture contest, and it's been fun getting the staff involved. We haven't put the pictures up yet. I'm still compiling them, but we're going to actually put them out in the reception area so the patients can get involved and try and guess who each other is as well. So next slide. Oh, is that it?
Yep. So that's just a recap. So we talked. Sorry, I'll try to hurry really quick, but we talked about the organization level and then the clinic level, and then we do believe that bringing that down and then to really work individually at the staff level will bring those scores back up to those. So if you want to just kind of flip through just really quickly, there's just a few pictures of some of the things that New Plymouth and Emmett mainly have done just for some employee satisfaction and just engagement outside of the clinic or even inside the clinic. So that was part of our admin team for wearing red. Value as an Action Award winner. There's Emmett dressing up for Halloween. More red, wear red at Emmett. Okay, sorry, we went over time.
All good. I was going to say, I really appreciate how you guys did very much talk about, you know, how you guys are as an organization, but then also how you narrow it down into your different clinics. And I think I have a question just around, I know you said, you know, your clinics are pretty rural and pretty spread apart. So do you find that you have different needs at your different clinics depending on where they are?
Oh yeah, huge differences. I would say especially between Oregon and Idaho, just because the way that they can get help through the states is totally different.
Right. Yeah, no, great example, I think, of, like you said, making it very clinic specific. I don't see any other questions in the chat, and I know you guys had just so much wonderful information to share. I really do appreciate it. It was all very helpful and exactly kind of what we were hoping you would share. You guys are doing a great job out there. So I don't see any other questions in the chat, but if people do think of things, feel free to put them in there, and we can definitely get back and we can round back with everyone, or we can round back with you all as well. But in the interest of time, I am going to move us on to our next presenter. So I want to say thank you, Lindsay and Jennifer, and then introduce you all to our next presenter. So next we have Adapt Integrated Healthcare with us, and Robin Peterman, who is their Director of Operations. So Robin, I am going to pass it over to you.
Thank you so much. Good afternoon, and thank you for having me participate in the Learning Collaborative today. I'm Robin Peterman, Director of Operations at Adapt Primary Integrated Healthcare. I've been in healthcare for 20 years and have worked at Adapt for 7. Today, I'm going to discuss some of the different tools, processes, and projects that we utilize to meet the PCPCH staff vitality measure. My hope is that you'll walk away with something today that you will either use to expand on an already great process, or maybe something you'll start new. Next slide, please. So first, I'm going to give you a little background of our organization. In April of 2021, we integrated with Adapt. Our name changed from South River Community Health Center to Adapt Integrated Healthcare. As an organization, we have over 400 staff and provide multiple services in 4 counties. But we provide the most services in Douglas County, which is geographically the largest county in Southwest Oregon. Our primary care clinic has 2 sites in the Roseburg area and 1 site in Winston. All sites have integrated behavioral health care. Between all 3 sites, we have 71 employees, and that includes 10 primary care providers, 5 integrated behavioral health specialists, and 1 psychiatric prescriber. I heard Valley talk about their mobile clinic, and we just got one as of Tuesday. So I have to say I'm super excited. I think the opportunities that that's going to give to our patients is going to be amazing. So even though we've all been hit really hard with COVID, last year our numbers actually went up with our patients served, our Medicaid served, as well as the service visits. So that was great. Next slide, please. Excuse me. So first I want to talk about the why. So why are we doing the staff surveys? Staff is our most valued asset, right? So we train our new staff, we make sure they're trauma informed, they're kind and courteous to our patients, they're engaging so the patient doesn't feel like they're just another number. We make sure to really listen to what they're needing so we can help with not only their medical, their behavioral, but also resources, right? Our patients, they need housing, clothing, food, so many different things. The other key piece that we've done since we've integrated is we wanted to have a no wrong door. That approach with our patients is to give them that warm handoff to another department and to help the patient have a seamless visit no matter what department they might end up in. So what about our staff? Are we following the same guidelines for them? If our employee is our most valued asset, what are we doing to prioritize our employee retention and satisfaction? Well, we contract with a company called Crossroads Group, and they do our confidential staff surveys. By having a third-party vendor, our goal is to make sure that our staff is very comfortable to give us whatever results, good or bad. You know, as an organization, we can't grow, right, if the staff won't give us that honest feedback. So once we receive our staff survey results, we then follow a simple process to engage our staff in identifying issues or concerns that have to do with performance, quality improvement, and overall morale. Our annual surveys, our results are reviewed by our exec team, which is our CEO, COO, our organization's board of directors, and like Valley, we are an FQHC, and so over 50% of our board of directors are patients. And then it goes to our risk and QI. After that, it then goes to our all staff meeting for our staff to review. And each group, right, have their own priorities that they look at throughout the year. Maybe it's the data that they're wanting to look at to maybe see what's working or what isn't working. Or maybe they're really interested in clinical effectiveness and productivity. But I think all of these groups are very interested in employee retention and satisfaction. And I really believe every clinic out there right now, that is their top priority. Next slide, please. So something I'd like you to notice on the slides, I have some of the slides coming that will be coming next that have quotes down at the bottom of them, and those have come off of our staff survey. Most of the time, the quotes are great feedback with positivity, and every so often we'll get some that maybe aren't quite as positive, but again, that helps us grow as an organization. So as the surveys are reviewed by different groups, different projects are identified, or maybe areas we need to take back to one of our monthly all staff meetings and maybe do a deeper dive. So at our monthly all staff meeting, we go over the results of the staff survey. We talk about where our scores increased and decreased from the year prior. We also discuss the suggested projects that have come from the board, QI, exec team that, showed some areas that needed improvement from our staff survey. We also talk about projects that staff would like to see happen. So a tool that we use for this that has been amazing, that I hope somebody uses this after we talk about it today, it's called our Mentimeter app, which allows an in-person response in real time. So this is a free interactive presentation software that we use. We first started using it to track who all attended our all staff meetings. Sometimes at all staff meetings, we have trainings that are required. So from there, it tracks everything, and we can then just see who all we need to follow up with afterwards who missed it. It's really easy. At the very beginning of our presentation, up on our PowerPoint, it's www.mentimeter.com, and it has a code. Our staff bring their phones. First thing, we've gotten them trained to log in, put that code in, and put their name in. So the other things the Mentimeter can do, as I talked about the deeper dive, is sometimes one of the examples on our survey that our staff said they needed help with was more training. So what does that mean? There's so many different things that we train on. So with the Mentimeter, we were able to ask open-ended questions. What kind of training would you like? We also could ask multiple choice questions if we wanted to. The other thing that's really neat about the Mentimeter, and I think there's lots of different areas we haven't even dived into yet with it, but you can also create a cloud visual. So at Thanksgiving time, we'll put an open-ended question of, give us one word that you're thankful for. And so you start out with this little tiny cloud, and as everyone starts to put everything in, this cloud grows huge of what everyone's thankful for. And it's really neat because sometimes, you think you know what your staff is going to say, and it's just great to see all the different things that the staff put out there. Next slide, please. So this shows you the Mentimeter question. One of the things on the training was, so we also went to Ocean Epic. We went to Ocean Epic during COVID. So all of our training was online and by Zoom. The struggle was real. And so anyway, this let us ask the team, so what specific trainings would you like to receive in Epic? Please indicate your department. For front office, they wanted more registration. For the providers and care teams, they needed to learn a better workflow and how to move from encounter to encounter. So this really helped us to get real-time information and to be able to go back and start a game plan. Next slide, please. So now we have the planning, implementation, and evaluation piece. So in the planning, we take the feedback and we drill down as far as we can go, right? And we take that information back to our QI group and talk through everything. We decide who needs to be on work groups and how often that work group will meet. So once we get that all figured out, we start our implementation process. So the work groups get started and they have to report back monthly to our QI committee. They talk about the accomplishments they've had so far, and sometimes those groups will start meeting weekly just to get their arms wrapped around what really needs to happen. And then they decide from there, make adjustments. Maybe then they can go to monthly for a while. And you know, in a perfect world, we might envision things to go a certain way and be seamless, but reality, there's usually always something not everyone can think about, or a hiccup might happen that really throws a ringer in things. This is a great time for that work group to come back to QI that next month. And then we have a bigger group to help problem solve these issues. So now we get to the evaluation piece. We think we're to an area where we need to go back to our staff and find out how we're doing. Are you satisfied? Are you not? Boy, as some of you know, this piece can be bittersweet, right? Sometimes we have success that first go around and maybe not. So sometimes we find out that very few staff are happy and we've got to try again. We've got to figure out what more we need to do. But we keep at it and we truly listen, and our staff know we're really trying at this point. We also know that each person is unique in how they think, learn, or analyze a situation. So our goal is to make sure that when an area of concern has been identified by the staff survey, we get the most detailed information from our staff so we can help them make the best decision. When it's time to evaluate the project and close the loop, we have different ways to do this. So we've talked about the Mentimeter. You know, that's the easiest way, especially if there's a project that we're doing that encompasses all of the staff. We can do it at an all-staff meeting. Again, it's confidential and it's in real time. Another way we do this is we have separate staff meetings throughout the month where, so let's say the training with Epic, we have a front office staff meeting, a back office staff meeting, and a provider meeting. So I can go to the front office meeting and say, hey, how's that registration training going? Or a back office manager can say, how's the workflows going on the encounters? And the same thing with the providers. The great thing about this is maybe the back office is rocking it. They've succeeded, they don't need any more training, but front office is saying, you know, we're still really struggling with the insurance piece, or trying to toggle from the phone note to the FYIs to something else. So this gives us time to really evaluate where we need to go next. Next slide, please. So on this slide, some of the projects that we took away. So we talked about Epic, and our IT team came in, we did all these different trainings, whether it was during all staff or we blocked schedules, and we scheduled time for that. Another thing that came out of the staff survey, though, that had to do with training was new staff didn't feel like they were getting the training they really needed. So we started a pilot group with the front office first, work out all the bugs, then we can move it to the back office and the providers. And it was a new position checklist. So it has all the different things we felt like front office needed to learn. Trainer and supervisor meet with a new staff member, 2 weeks, 30 days, 60 days, and they discuss how they feel everyone's doing. The other thing that was created by this is we had a new position that's called a front office trainer. So one person is training our front office, and that way everything is uniformed, done the same way. They get the same guide, the same information, and that's helpful when we have multiple clinics. Next slide, please. So I want to thank you for taking the time to listen to my presentation today. Although the staff mentioned on this slide take the lead with our staff surveys, it truly is the employees who are driving this effort. So as I said before, employees are our greatest asset. Thank you. Any questions?
Thank you so much, Robin, for sharing all that. I don't see any questions in the chat. I think someone might have had their hand up earlier, but I saw it kind of come and go really quickly. So I just want to pause and see if anyone does have questions, put them in the chat, or if you want to unmute and ask your question, that is also welcome. It looks like I have Michelle V. I see your hand raised if you want to unmute.
Hi, I am interested in checking out Mentimeter. I was just curious. I was just on my phone kind of eyeballing it. And is it one of those situations where they like navigate to it through the browser, or how does it like practically play out? Maybe you already covered it, but I missed it.
So you can go on to, if you have your phone, if you get on and you do the www.mentimeter.com, it pulls it up and then it asks for a code. And so we have a staff member who gets us all set up. And something I didn't mention, so I'm really glad you're asking about this. When you get this set up for your group, you only have 72 hours. So it's something you don't want to do too far ahead of time. And that specific code will then pull up your questions. And then it also keeps all of that for you. So let's say you've made a template of questions. None of those go away unless you delete it. So if you're doing it to track your staff each month, you can just pull that up and it'll give you a new code for each month. You don't have to recreate the wheel, so to speak. So that makes it really nice. And it's really quick and easy. We haven't had any staff have any problems trying to get into it or navigate around with it.
I know I've personally used Mentimeter before in meetings and stuff, and I always find it very, very helpful and kind of engaging and fun. So
It is.
yeah. There is also a comment in the chat. Eric from Virginia Garcia would love to get a copy of those job-specific competency checklists and the no wrong door form. I don't know if that's something you're comfortable with sharing, or if you want to think about it. Yeah, so feel free to send it to me.
You know, it was something really helpful. I'm really glad that the staff talked about it. We've seen a huge difference in our new hires and how quickly they're progressing. You know, even someone who's had medical experience for years, every place is a little different, right? Every place has different flows. And so this has really, really helped us and our staff. It's ever evolving though. We've had staff who say, well, what about this? New hires that said, you know, this would have been more helpful if you did this. Perfect. We changed it. The next hire, we then did something a little different. So it's been a really great process and we've just loved that this came out of the staff survey. So I will make sure my contact information's up there. If you want to email me, I'll send out to whomever would like to have a copy of this.
Or even Robin, if you want to send, if you wouldn't mind sending those to me, I can just send them out, you know, in an attachment with the email. I know there's a few people in the chat who look like they like it. So feel free just to send it to me and I can do that legwork for you.
Perfect. Thank you.
Awesome. Well, again, I want to really thank you, Robin, for sharing. It was incredibly helpful. And thank you again.
Thank you.
So with that, I think we're going to move on to our last portion. We'll go to the next slide. And so we really wanted to wrap up our session and have a conversation about the role equity plays in staff vitality. So as we all know, PCPCH clinics, they have employees across Oregon. They're incredibly diverse. They represent a broad array of ages, races, cultural backgrounds, abilities, sexual orientations, and gender identities. So in considering approaches to increasing staff engagement and morale, it's also important to consider the wide range of life experiences represented by your staff. Diverse employees may have distinctly different needs and challenges. So centering equity in the staff vitality conversation from the start can help ensure the needs of diverse staff are heard, considered, and responded to appropriately. So next slide. To explore the topic more, we've invited Virginia Garcia Memorial Health Center, as well as North by Northeast Community Health Center, to answer some questions about their approach to addressing diverse staff vitality. So I'm gonna have both of these practices. We're gonna introduce you, give like just a brief introduction to who your practice is or are, and then we'll go into the questions after this. So first, I want to introduce Eric Osland, who is a talent development manager at Virginia Garcia Memorial. So Eric, I don't know if you want to give us a little brief introduction to who Virginia Garcia is.
Oh, sure. And I'm a stand-in, just so you know.
We
Aniele
appreciate it.
Franco couldn't be here, so I'm stepping in for, I think, other people who could do a better job of this. I'll go quick. We have a 1 o'clock time stop, right?
Yes, yes.
Okay, so we're 600 employees, 52,000 patients, 17 physical locations doing primary care, dental, behavioral health, pharmacy, standard stuff that you'd see from a community health center.
Yeah. And I know too, you guys are also very invested within the Latinx community, and I believe you have a large majority of your staff. I think
Yeah,
you were
we like
telling
to
me it was like
say 50% of
or
our
so.
patients are, yeah, I mean, probably 50% of our patients are best served in a language other than English. Now, not all of those are Spanish speakers. But,
Yes. And your staff
and
is
we have
very reflective
60
of that, too.
different languages in our clinics.
Fantastic.
Yeah.
And then our second presenter on this panel is Dr. Gina Guillaume, who is the medical director, of North by Northeast Community Health Center. So Dr. Guillaume, if you want to introduce your practice.
Thank you again for having me. So as Dr. Guillaume, I am the medical director of North by Northeast Community Health Center. We were founded in 2006 by a Black pastor and a Jewish doctor. So we've been around for almost 17 years in Portland, serving North and Northeast community. At the time, it was a large Black community, and that is our mission. We are focused on promoting African-American Black health. We're a staff of 9 women, all women, 7 of whom are Black. And we also have about 850 or so assigned patients. About half are established, and of our established patients, 60% are Black. So I'm really thankful for this mission-driven opportunity. I've been the medical director here for about 1.5 years. So great to meet you, and I'm excited for this talk.
Thank you. Let's go to that next slide. So to facilitate the conversation, we are going to exit out of the slides. Before we do that, I just want to review what the questions are going to be for everyone so you see them. We're also going to drop the questions in the chat just so everyone can see them and then know what the questions are. But these are the 3 questions we'll be talking about, and I'll give each of you a minute or 2 to answer. So the first question, and I'll go through the question. I'll ask the questions in a minute. I'm just going to go through them first real quick. The questions are, what are some examples of the needs of your diverse staff? How do you support your diverse staff? And then how do you develop vitality activities inclusive of your diverse staff? So with that, we're going to drop the slides out so we can all see each other and have a little bit more of a conversation. The questions will be in the chat. But let's jump into that first one. So Eric, I'll have you go first. That's kind of, I guess, the order we just started in. But so what are some examples of the needs of your diverse staff? What are things that come up?
Yeah, I'll try and be quick. I'm going to boil it down to 3. You know, there's other needs. So growth opportunities, an accepting environment, and probably a place where they see people, you can see people in leadership roles who look like you do, right? Work-life balance, and that's kind of one for everybody.
Absolutely.
But yeah, I would start with those.
Absolutely. Dr. Guillaume.
Yeah, so I think that the needs of our diverse staff are definitely collaboration. I do get a sense that our staff want to be included in decision-making processes. So as much as possible, trying to get their opinion. And, you know, for our Black community in general, historically and currently, we're community-oriented versus, you know, infrastructure protocol based. So it's definitely important to develop relationships, collaboration, safety, where people can be their authentic self, for instance, wearing braids in the workplace and feeling comfortable without, you know, being judged for it, for instance, and just honestly having that equity-based lens and understanding the people that you work with.
Yeah, great. So with that, how do you then support your diverse staff? And Eric, we'll have you go first again.
Okay. Well, I mean, if I focused on those areas we talked about, like an accepting environment and growth opportunities, a place where you see people in leadership roles. So like, you know, we have, I mean, we're big, we have advantages, right? With 600 employees. So we have a DI program manager, right? Who focuses just on those kinds of things. An equity committee. We have tried to take trauma-informed principles and say, how do we apply those to our organization? So can we create learning environments that are trauma-informed, meetings that are trauma-informed? Lots of training with staff around communication, training with managers around communication, leadership training, micro messages, all kinds of things that are, you know, aimed at creating an accepting environment. If I wanted to go on to other stuff, I want to make sure I'm leaving time for Dr. Guillaume. So, but you know, lots of growth opportunities. People need chances to see that I can grow. So we've created pipeline programs where it's like, oh, you want to be an MA? We'll pay for the schooling and get you like an apprentice that you can work as an apprentice in one of our clinics, and we'll pay for the MA program. DA program, same thing. We'll pay for the schooling, get you into one of our sites, pharmacy. And so we're trying to do a lot of pathway programs. We've opened up a tuition assistance program. That's the kind of program where you're going to get extra points if you identify as BIPOC, if you identify as someone who's didn't have parents that went to college, right? You don't know you're getting extra points when you make that application, but you're getting extra points. So there's just probably, I mean, I could go on forever on the things we're doing around DEI and inclusion, and
And Dr. Guillaume.
I'll stop.
Thank you.
No worries, Eric. Don't worry. Please say what you have to say. I'll also keep my responses brief.
Yeah. Well, I mean, the other thing is, you know, just if you looked at our executive leadership, and people, you might see one person who looks like me, right? And our staff are, you know, if you look at who our frontline supervisors are, they're all coming from the staff that we hire, which is a really diverse staff. So I think that's really important for people to feel like, oh, I see people who look like me in leadership roles here. I see people who look at me at the C-suite. And we have that, like, just tons of that. And if you look at our, I won't pull up an org chart, but if I did, you'd be like, oh, wow. Okay. Yeah, I see one guy that looks like Eric, and that's it.
Yeah, and I think for me, how we truly support our diverse staff is our fabric. To be honest, it's not simply doing activities and, you know, different events. We actually have a racial equity policy. Like, that is something that was worked on by staff in 2019. It is posted on our website. It was also vetted by our Patient Wellness Council, who are prominent members, our patients in the community, and voted on by the board. So it's important that we, you know, exude that policy through everything that we do to make sure that staff are affirmed and feel safe. And I'll also put the link to that racial equity policy in the chat for you guys to check out at your earliest convenience. But from there, we support our staff, again, by being inclusive, doing a lot of surveys. SurveyMonkey is our surveys of choice. You know, we check in regularly as well with staff, even during our monthly. We do 2 meetings per month where we check in as a big group, and we do check-in questions, going around and seeing how people are doing. I've started doing listening sessions with staff as well, most recently, where I just get in a room and just ask, how are things going? How can I better support the team as a leader? And I'm hoping to do more of those and then do a post-survey afterwards to see if people found that helpful or not. One thing I love about working with a diverse community is that they're honest. Honesty is our best policy. So it is helpful to not be defensive when we are hearing feedback. I think that is one way to build trust and equity among diverse communities, is to listen and then hopefully back it up with more understanding and action.
Yeah. And then our last question is, how do you develop those staff vitality activities that are inclusive of your diverse staff? And I know you both already sort of touched on it a little bit, but feel free to expand a little bit if you want in the last couple minutes that we've got.
Yeah, do you want to go first?
Sure, I can go first. One thing is our executive director, Susie. She's been with the clinic since 2007. So she's definitely has a lot of understanding on her shoulders. But she recently started doing like a staff likes and dislikes survey, where we are asking specific questions about what do our staff like to do, their hobbies, what do they enjoy, how do you celebrate your birthday? Because here we celebrate birthdays. So in terms of like building that, you know, rapport, that community, we are very intentional about how we personalize gifts and celebrations for our team. And that definitely is one way that we've been developing those activities. We also have a consistent feedback loop. We do like annual staff supervisor surveys as well. And that is one way that we can capture any input, ideas that our diverse staff needs, and we listen. I can't stress the importance of that, like having a culture where you listen to people and hopefully move in that direction. But that's all I have.
Yeah. And Eric, you want to share real quick? I know we're right at 1, but we can go a couple more minutes.
Yeah, I want to
give
honor
you the
people's
share.
time. Yeah, I mean, yeah, I loved hearing what Dr. Guillaume said. It's beautiful stuff that we should learn what you're doing and do more. But you know, we just have tons of things going on in the organization around staff vitality and support. It's a tons of wellness program type things. You know, every other week there's a 30-minute meditation, 12 to 12:30. You want to join it? It's during your paid time. It's not your lunchtime. This is paid work time. Take the time off. So I could just go on and, you know, like lots of things. You know, we're lucky. Like I said, we have size, so we have some resources that a smaller place doesn't have.
Absolutely. Well, I want to thank both of you for sharing and for having that conversation with us. It was very helpful, and I think it's always insightful just to hear what all kinds of clinics are doing, especially though when we're talking about diverse staff. So thank you very much. That really wraps up this learning collaborative. This, like I said, this is recorded. We're going to get a copy of the slides out to everyone this afternoon, and then we'll get a link to the recording shortly after, sometime next week. But thank you everyone for sticking with us. We appreciate it. I hope you all have a wonderful weekend, and thank you for joining.
Thank you for having us.
Of course, take care, everyone.